All right, welcome everyone to the February 22nd Health and Human Services Committee meeting. Are there any changes to the agenda? I know that it hardly counts, but there's a duplicate information item. So the bottom of the page of the agenda, it says information item, budget adjustment, veteran services. There are two of them and only one of them is real, so we just cross one out. Any other changes? Okay. Don't think we have any public comment. Is that true? No public comment? Okay. Chair's report, I just have two things to mention. One is, some of you may remember that Mike Stigler, for the last 2 years, if I'm not mistaken, has introduced a resolution or brought up a resolution to propose to New York State that we change the health insurance system. And his proposal is that all cancer treatments would be covered. And I think he formally introduced it last year and maybe informally the year before. Anyway, he would like to do it again. So I've tentatively scheduled it for next month, unless we have something major that, pops up and displaces it. So I'd let Mike know that, and he's put it into his calendar that he can be here to present it, and we'll get it in writing beforehand. So. And then the other thing that I wanted to mention is I just put a piece of paper on everyone's desk, which is the liaison assignments for 2023. I had already communicated with everybody via email. Why don't you take a quick look, make sure I got everything right, and then when everyone thinks everything's right, we will just do a quick vote to make it official. Okay. Can somebody move the liaison assignments? Travis moves. Randy seconds. Any further discussion? All in favor? Okay, that is unanimous. Thank you, everybody. And that brings us up to our next item. So I want to welcome Dr. Martin Stallone, CEO of Cayuga Health Systems. How did I do?
You did perfect.
You have a lot of titles.
I do.
Online. There are a lot of different things, so I hope I got the right one. And here to talk about an after project report on COVID testing that the county was involved in. And then after that, we can do a quick question and answer. I have a few things that I've already alerted him that I'm going to ask, and then if there are other questions as well. Good? You're on.
Thank you, Dan. Thank you, everyone, for having me. I think I speak on behalf of our whole administration at Cayuga Health, which, by the way, is now over 30 companies in partnership under one common control. I speak on behalf of our board of directors, where we appreciate the opportunity to report back on what I think we all regard as a fantastic collaboration, the cooperation and the support from this county to our health system, and the services in return were unique among counties in New York, I believe, in many respects, which I'll highlight. We did remarkable work. I have to point out, I see Frank Krupa online, the public health department, now Whole Health, was instrumental in this. So everything I talk about was done in partnership with county government and what is now Whole Health. But we really appreciated it. I think there was a time for boldness. I talked to the then county administrator, and we talked about some cooperative arrangements that at the time seemed unlikely to happen, and yet they happened because the circumstances demanded it. But I think we could all look back and be proud. What I want to present today is just some staggering numbers and statistics about what we were able to accomplish. And it's hard to go through everything. So if there's other questions, I can report back again. But there is a slideshow which I'll submit to you guys. I also have a data set that I pulled from public sources that I can give separately if you wanted to know where the numbers come from, but many of the numbers come from within Cayuga Health, but I'll go through them, and if there's any questions, please don't hesitate to stop me here or online. If you just put your hand up or interrupt, I'm happy to take questions. If we could go to the first slide. As you know, the main partnership where the financial support flowed was to testing services, but the testing support funded a lot of other activities that were not so obvious at the time. In total, Cayuga Health accomplished 2.768 million tests. Those were tests that were run and analyzed in our lab. Our lab is at the hospital, but we stood up different labs. Some of that was at Cornell in the Cornell COVID testing lab, CCTL. But what is little known about that operation is that that was a CMC lab. All of that infrastructure was leased to the hospital, and the hospital operated under its license, its medical oversight, its procedures, its science, and accomplished the testing. 1.897 million of those tests were for Tompkins residents, with the remainder being for people outside Tompkins County, with the highest numbers being immediately adjacent to Tompkins County. The mass sampling site, which existed at the mall, for which we rented and solidified our relationship, which then led to the purchase of the mall and our intent to continue operating there. That mass sampling site collected just under 280,000 tests. That was the drive-through operation. Different styles of collection, first nasopharyngeal, which is the more invasive technique, later saliva technique, but always collected at that site. There were at one point 5 public drive-through sites, 1 in Cortland, 4 in Tompkins County, that were run by Cayuga Health, and then there were no fewer than a dozen sites across Cornell and Ithaca College that enabled the college students to be in school through surveillance testing. Tompkins County, our last statistic I wanted to cite, paid for 75,600 tests for Tompkins County residents without an alternate payer source. Those funds that came through those tests paid for more than simply the test. It paid for the development of the test, it paid for the drive-through, it paid for a lot of the vaccination efforts that we undertook. So that was the sole payment source, if you will, but it funded a lot of other activities that we undertook. Slide. Breaking it down a little bit, I alluded to this, but the CCTL and Rheonics were the 2 major platforms. I listed the positives and the negatives. In total, we detected 50,577 positive values. Those are not positive individuals because some individuals were tested more than once. Again, the Tompkins statistics are there, and the mass sampling site and Tompkins County funded tests are listed below. In terms of what this accomplished, if you move to the next slide, a positive test is a positive test, but what it really did was equip a public health response that allowed those individuals to confidently isolate or confidently not isolate. And so that allowed our economy to continue to run. What happened, and this was in coordination with the Public Health Department, was there were over 30,000 nursing isolation and outreach calls in support of Tompkins County Public Health. Again, those efforts were funded by the testing costs. There were additional 14,000 calls to people outside of Tompkins County. There were 43,000 additional public information calls that came into the Cayuga Health Partners call center. Those were the instructions that were given to people about what to do, when to test, what about their symptoms. We accomplished over 2 million daily health checks via custom apps that were developed by our internal software development team on demand, and that equipped school districts to screen students before coming to schools. And again, if there was concern based on what was put into the app, there was a human call that was made, again, funded through the testing operation. And then Cayuga Health prepared just under 9,000 travel documents to allow travel during the restricted travel period. If you move to the next slide, I'll go through this slowly, but in essence, I put together from different public sources information that gets ultimately to the testing rate of the community. It's hard to read here, but if you look at the county population, which at one publicly reported source is about 105,000, if you look at the number of tests cumulative that were done for Tompkins County residents, again, some of that testing was not Cayuga Health testing, but if there were 3,000 tests per the New York State Department of Health website, you can have a tests per person throughout the entire period of the pandemic of over 29 tests per person, which is greater than 4-fold the next highest community. So we were, without any exaggeration, substantially higher than any other county. The cumulative positive rate was the lowest. That's because we did more surveillance testing than everyone else, and I'll get to what that actually meant with respect to morbidity and mortality in the next slide. But depending on how you looked at it, we were several times more tested and a several times lower positive rate than the next highest county. I pointed out with the red arrows down to the middle of the slide that when you think about other counties that are in our area that are not usually high on the list of public health accomplishments, notably Cortland County and Schuyler County, and Schuyler County is beloved to us because that's the home of Schuyler Hospital, so this is not to be pejorative, but they typically are lower in the public health performance list. Cortland and Schuyler were closer to the top of the list because of the work that we did here. So there was a kind of halo effect. Slide. This next slide just puts it into mortality. And if, again, I was looking for COVID-related fatalities, again, I tried to normalize the statistics because if you look at different data sets, the exact numbers are a little off. So the correlation between the number of positive tests on this data set was within 1%. So I feel comfortable putting mortality with the testing statistic, but our COVID mortality was also the lowest statistically per population in the state. And if you compare us to average, that would be about 181 lives that were saved, mortalities that were averted by that simple extrapolation. In other words, if our COVID mortality was average, we would have lost 181 more people than we did based on our population. So I think that's something that I think this body should take credit for. I think that it's fair that the legislators take responsibility for actions when things don't go well all the time. This is an example of where investments were made and lives were saved because of that investment. That's my opinion. Slide. Again, this is just stepping through what I already stated, but the testing allowed public health interventions and gave confidence to our society to continue operating. Schools were opened in the fall of 2020. That didn't happen anywhere else. I believe Cornell was the only Ivy League school to host students in person. There were no hospital diversions. The reduced burden on hospitals certainly helped. Most all hospitals, everyone that I'm aware of in New York, with the exception of Cayuga Med, went on diversion at some point, meaning closed its door to hospitals. That happened for only 6 hours right around Halloween in 2021, not before that and not since, which is, I don't have access to the statistics on how frequently all the hospitals were on diversion, but if you can take my word that it's substantial. The early objective, obviously, was aggressive identification and operationalization of testing resources. We took advantage of the EUA and regulatory relaxations that were allowed. The best example I can think of is the ability to turn a veterinary laboratory into a human laboratory. I would have passed out if you told me that was possible before the pandemic started. We did make innovative organizational moves that made all the testing diagnostic. By putting everything under the hospital, because not everyone needed to test through a hospital, we could rely on negative tests as diagnostically negative because of the testing parameters. So that was why we did it. The other thing to note is that we used capabilities that were developed and paid for other purposes for testing, vaccination, and coordination of public health interventions. So unusually, we have a software development team for patient-facing applications. That's what we used for scheduling, but we had to have the team of software developers who made HIPAA-compliant applications to be able to command them to make these applications, and they spent many sleepless nights rapidly making product. Mass movement operations, my involvement in the New York National Guard, I knew how to move a lot of people. That was a pre-existing capability within our system. Our agile lab operations and our early education based on our New York City deployment was also very helpful. That is to say that our hospital performance was enhanced because our providers went down and saw COVID-positive patients who were the sickest of the sick at New York Presbyterian Hospital. And again, I mentioned this, but testing funded other operations like the vaccination enterprise, which was best in region. Slide. This is a schematic of what I was talking about. Our main lab within our hospital was extended with the permission of public health to include our new operation that we called the CMC Innovation Lab that was set at Brown Road. with Cornell CCTL, also within that organizational construct, and that was regulated by New York Department of Health. It was a CLIA certified operation, medical direction, all of the policies. This was a legitimate hospital lab that was stood up in effectively weeks, and that was, again, no small task. The only example of this that I know of in New York State. Slide. I thought it would be helpful to go through a timeline of some key events through the pandemic, just to kind of go through history of what happened. March 7th, the first positive case in Tompkins County happened. We started an incident command at the hospital. The reference lab at that point was Wadsworth and the Mayo Clinic, with turnaround times of about 3 weeks. So imagine coming to the testing center, getting a test, and not knowing whether you were positive and negative until after isolation and quarantine would have been appropriate. We closed down the Craft Road building on March 9th and started a drive-through operation. That would be the learning experience that we transplanted later to the mall. The sampling capacity at that time was about 120 samples per day. It required a provider order that went away later. March 17th, we opened the mall drive-through with the sampling capacity, because of the different plant, of about 800 per day. This was without a provider order, using the regulatory relaxations that I mentioned. On April 17th, the first nursing home mobile testing event happened. Might not be fully appreciated, but we deployed dozens of teams into nursing homes to accomplish testing when it was required. And that was quite an experience, just put it that way. April 20th, there was an IRB, an Institutional Review Board study with Cornell that was approved to develop testing for PCR and antibodies. I think that was began a research relationship between our hospital and the university. May 1st, Rheonics received the EUA for single upper respiratory specimens. So that means we couldn't do pooling yet. We had those machines in our facility, hooked up, ready to go, waiting for the order, and on that day it started. The capacity at that point was 176 samples per day. Again, the capacity of the sampling center was much higher. Rheonics was 176, and turnaround time, which was very hopeful at that point, was basically the next day. And sometimes it was even the same day, but on average it was within 24 hours. On June 10th, the executive order requiring twice-weekly nursing home testing started. That depleted testing resources from the region for the public. All of the resources were going to nursing homes. On June 18th, we went live with pooling of upper respiratory specimens, and the capacity increased to 500 a day. That's the organic testing capability that we were able to test at the hospital. And again, pooling 5 people into 1 vial and run the test with the reagents. If it's negative, you know all of those people were negative. If it's positive, you deconvolute the tube, you go back to the source samples, run 5, and figure out which one was positive. There's a lot of science that had to happen that I'll step through, which our people did, because that was not the basis of the approval for the EUA that Rheonics got. We did a New York State lab-developed test with our own scientific process to stand behind that process. In July 8th, we completely transitioned to pooling, so this was the way we went about it. The capacity organically increased to 2,200 per day. At this point, we were racing to bring schools back, so we were racing for the idea of having 8,000 tests to meet the needs of the community and bring schools back. Again, that was an economic objective as much as it was a public health objective. On August 8th, we again advanced our IRB relationship with Cornell through Cayuga Health, expanded to recruit patients for antibody test development. On August 24th, we went live with their CCTL, and this was the capacity that would equip the students, and that also used pooling for 8,000 tests per day. So that was in addition to our capacity at the time of 2,200. And then next slide. Quick detour just in the science behind the pooling. We effectively, this was summer of 2020 when there weren't many COVID positives. We recruited every positive that we had come through our lab to give samples to prove pooling happened. This is when we were doing single testing. We took these individuals and then recollected them, deployed people to their homes to collect the samples, and had to do it rapidly in order for them not to resolve, and then they would be a negative on the test. So effectively, this was early summer 2020. We did paired collections for each of the 4 specimen sources. So the volunteers were rigorous people. They got tested 8 different times. The symptom status was noted, and they were stratified into the 3 groups: asymptomatic, symptomatic, and post-symptomatic or resolved. The sublingual swab showed poor sensitivity and was discontinued. That was hopeful at the time because it was the least invasive, but didn't work out with respect to the test parameters. And so for the nasopharyngeal, anterior nair, and saliva, pools of 5 with 1 confirmed COVID and 4 normal volunteers were tested. You can see with 70 positive how this exploded in terms of the numbers of individuals involved. We ended up having about 55 to 60 positives for each branch because the patients no longer tested positive. Some ended up resolving by the time we got to them. And we developed a hyperconcentration method that allowed this to happen. So while other institutions were doing this exact experiment, we got it to work because our lab staff actually spun down and hyperconcentrated the sample, which actually prevented dilution. So there was a little bit of a scientific technique that worked and added value. And then there's some more details about the science. I won't belabor, but the point is we did it for the Rheonyx platform and the tetracore assay, which was used at Cornell. So we did this science on 2 different platforms, and the Rheonyx data was reported a little bit differently in validation. Cornell had higher sensitivity, but it both met the FDA level of performance. The next slide. The nasopharyngeal, anterior nair, and saliva were all acceptable models with 100% symptomatic sensitivity, which was really desired. That needed to happen. If people were symptomatic and they were positive, we wanted the pooling test to pick up every one of those. That would have led to poor detection. And then the specificity, which was all in the 90s, was certainly helpful to rule that out. And the nice thing with pooling was that if there was somebody who was negative, you actually had 2 chances at it. So it actually helped make sure that negatives were truly negative. And I just mentioned that information. So back to the timeline, and we're almost done. One more. There you go. So on September 1st, 2020, we moved testing out of the hospital because we ran out of rooms. This is when we were getting more of the Rheonyx machines. Our capacity increased to 14,000 a day on top of the 8,000 that Cornell had. IRB expanded to include Rheonyx sharing the EUAs for pooling. So we were equipping that platform to have pooling in other communities that it sold the platforms to. At that point, in mid-September, we were testing 10% of all of New York State, and we went live with saliva pooling in the mid-fall 2020. Slide. The benefits of saliva are listed there, but basically this was less invasive, less labor intensive. Students in particular were able to have saliva containers, and they were able to drop it off, so reduce the number of people who were putting themselves at risk collecting samples. Fewer supply chain concerns, room temperature sample was possible as opposed to requiring refrigeration, all logistic advantages. Slide. In October, we started sequencing. Hospitalizations began to surge. We received at that point, without the organic Cornell and Rheonyx-based testing, we got our first ID Now. You heard that probably in the news, that the Abbott ID Now came, and we had about 10 tests per day. So we had already had tens and tens of thousands of tests under our belt. The total tests were listed there at 252,000. In November, we submitted the LDT to New York State to validate all of the things we were doing scientifically. In this case, we were already operating with the science that we had produced, but we went back to New York and they approved the LDT and validated that it was positive science. November, we expanded the IRB with Cornell and Rheonyx again to include the county for a sequencing dashboard. Slide. And then in 2020, obviously December, the vaccines began to be distributed, almost with a surprise rate of availability. We didn't expect that mass operation, but the same resources that we did for testing were used for vaccination, namely the patient registration, namely the people who were manning the flow of people through the site, et cetera. And then in December, there was an EUA granted to Rheonyx using our validation. So that was a benefit to that startup company. Later in 21, the hospitalizations surged in January. That's where we got our highest peak of patients to about 40 patients per day. Our inpatient census was over 150. Again, we normally run around 100 people spending the night in the hospital, so we had a fairly substantial increase in illness. The first variants were identified early in New York State. Again, the IRB again was expanded for the home saliva kit. So you'll see that we were continually doing science that helped our operations. By March, all of the COVID was the B117 subtype. Slide. In July, we celebrated that COVID seemed to be over, and then we suddenly started to see Delta. By July, all the COVID was Delta, and the report, we reported the end of the pandemic was premature, and hospitalizations began to spike again. We stopped using Rheonics. We would later bring it back out again to consolidate around Cornell's process because of their desire to continue surveilling, which was a good decision. And Cornell went live with the saliva technique that we developed. Slide. In 2021, the second platform, other than our two organic platforms, I call them, were received with the Cepheid tests limited to about 20 a day. So again, we would have been LabCorp, Mayo, Wadsworth with 10 days to 3-week turnarounds were it not for our organic capabilities with the first Omicron variant coming right at the end of the year in 2021. Slide. In February, we had another peak of hospitalizations. This was the Omicron hospitalization peak that really went from January through, dipped down a little bit and then surged again in May. Really dipped off at that point with the community impact being low and surveillance testing stopped at Cornell. Rheonics finally received EUA for the home kit saliva using our validation. And I think the next slide is that we, go ahead one more. We actually closed the COVID testing at the mall with the total that I listed before at 2.77 million tests. At that point, we got our third platform just in time, the Panther, and that was validated and it exists at the hospital. So now we have all of these platforms that would have done us basically no use through the pandemic were it not for what we developed ourselves with the Rheonics and the CCTL. Slide. My summary is, obviously, I think anyone who comments in retrospect about the pandemic states they would not want to go through it again were they to have the opportunity, but the cooperation that we had together was exemplary, and I think it represented the very best of our community, and it demonstrates what we can achieve together under normal circumstances. I like to remind people that Cayuga Health is a not-for-profit organization. It's our health system. It's a community good, and we appreciate the support we gave to the community, but also the support we got in order to perform what we did. And again, maybe beyond the scope of this discussion, I wrote there that I think that this kind of collaboration and struggle for success around what is the most important public service in my biased view, that is delivery of high quality, affordable health care to your constituents, should be something that we continue to talk about and endeavor to accomplish. So I'll stop my comments there. I know there's other questions you may have, and thank you for allowing me to give you these statistics. This will be submitted for your records, and the data set will be submitted as well.
Dr. Sloan, thank you. That was amazing set of facts and the timeline, and I could relive, I was reliving some of the ups and downs during that time. I also, you used the word Herculean a few times there. That's an excellent word. I find, the response that was generated here, and also the whole vaccination program nationally, the speed at which it developed and the effectiveness, kind of thrilling, on top of this other terrible thing that was going on. So I'm experiencing some of that again today. So if there's any questions about this part, let's do that now, and then if we have other general questions about the Cayuga Health Systems, we can do that. So COVID questions first. Amanda.
Well, I just would sort of reiterate what Dan just said. I mean, that was great, and people have used the word hero when it comes to the pandemic and the people who have done the work behind the scenes. And as you were describing it, I felt like, my gosh, there was people in these labs, actually doing this work. That's so amazing. And I'm so grateful that our community was supportive of that and that we were supportive of that, definitely sort of reliving it and kind of I don't think any of us maybe have really processed emotionally or mentally what the pandemic was like because we're just trying to get on with life. But thinking back on it, it was a very intense time, and knowing that you and your folks were doing all of this was amazing. So I appreciate the numbers as well, but just sharing, you know, what people were actually doing to make things work to take care of people was really moving. So thank you.
Thank you very much.
Randy?
Wasn't on the legislature.
Microphone.
I was on the legislature when all these things happened. As a user that had COVID twice, I was impressed with how the county handled it. It really was. I do have a couple questions. So the Tompkins funded of 76,000. I know most of the tests were funded by New York State, or for the federal government, I guess, money that came down. Does that mean that the Tompkins County actually paid for 76,000, or is it just money that came through us somehow?
Yeah, my understanding is that there was early on a recognition that there were public funds for people who didn't have means to have tests and so on and so forth, and that the county would be in a better position to access FEMA funds, and that turned out to be the case. I don't know the specifics in terms of what the county got on the backside dealing with the federal government. I don't think it was state, I think it was federal funds, but I know that certainly we were advised early on that we would have less success than the county to access funding for the things that we were doing that were for a public good. And that was the nature of the conversations I had with the then administrator.
Okay.
But we also helped purchase those machines, didn't we?
Yes.
One machine.
Yes.
Yeah.
Yep.
The Rionics.
Early on,
Yeah.
2 machines were given for a substantially reduced amount of money compared to their market price for the reciprocal services of teaching the company how to hook up to hospital infrastructure. So our people paid by donated services to Rionics, the first 2, and then the next 5, and there were only 7 available. And the next 5, the city bought one, the county bought one, the trust associated with Tompkins Trust bought one. There were a couple of, and we bought another one at full price, and we kind of were chipped together. Now, at the time we were doing this, if you recall, hospital elective surgeries were stopped. Our inpatient census was 40, 155. We normally run at 100. We were down to 40 patients in the hospital. That was when heart attacks and strokes were disappearing. The hospital was suffering financially. We were very reticent to go out and buy a fleet of machines at 6-figure prices. So we passed the hat around, so to speak, and we got the machines, and then we promised to basically provide this service back to the community.
And before, at the time we had Amy Hendricks. She was our deputy county administrator, and she was tasked with keeping track of the nitty-gritty of all the funding and all that. And Amy has moved on, so we've lost some of the richness of the detail. But I think, and maybe it was you who asked recently, Randy, that we're still getting some of that money back from FEMA. It hasn't all come in yet.
Yes.
Hang on, Randy's still.
And didn't Amy, is she the county administrator now at Auburn or something? Or
City of Geneva. Yep. Mm-hmm.
If I could, just to assure you all that we are still accounting and tracking that and submitting for reimbursement to FEMA through county administration and the finance department. So for all of the testing that has taken place, we've submitted for reimbursement to FEMA, and there is a lag in that reimbursement back to the county.
I have a few questions. I apologize. So the mortality rate, do you think that some of the reason that Tompkins County is because we have a lot of college students, younger people? Did that help with that?
Those students are not typically in the population, but yes. And I think typically that number doesn't include all of the students that don't have residences here. So if you live in Clara Dixon Hall, where I went to school, I wouldn't have been a county resident, but grad students are. So you do have generally a younger, healthier population, but I don't think that accounts for everything.
Okay.
Yep.
Makes sense. So did the mortality rates improve after vaccinations started happening?
Certainly. I mean, certainly. I don't have, I didn't do the statistical analysis on this, nor would I personally be able to do that, but just what I observed anecdotally in the hospital in terms of the severity of illness was really curbed by the vaccine. And in fact, certainly the first strain for which the vaccination was the most effective in abating the symptoms and preventing transmission, there was a dramatic impact in the early 2021 timeframe.
In diversion, so that means that you didn't have enough beds for people, you had to send them someplace else? Is that what that means?
Yep, diversion means that for all but the most serious circumstances, the emergency room signals to the EMS community to take patients to an adjacent hospital. This is coordinated by the New York Department of Health. You have to report going on diversion. You're allowed to be on diversion, but sometimes you're stating an incapability that they can't argue with. And so a hospital may, 6 a.m. on a day, go on diversion for 24 hours and then come back on. And for instance, when Cortland Hospital, which frequently goes on diversion, when that happens, we feel the increased number of ambulances coming to us. And so that we regarded our geography, meaning we're the only hospital for a 25-mile radius, as an imperative not to go on diversion. And this was a rallying cry for us, but what helped us not do it was the burden of disease that we were experiencing, the fatigue that our staff experienced. Not that we don't experience those things, but in terms of pushing us over the brink to go on diversion, I do think our vaccination programs, I think our testing programs, I think the energy we had around the COVID rallying cry helped our hospital not go on diversion.
One of the things that was discussed early on as COVID was that there will be a shortage of respirators. Did that become an issue for Cayuga Medical? Or?
No, that was really a New York City phenomenon. We donated respirators down to New York City. The vet school came up with respirators. This was when the governor was on the TV talking about if anybody had an idea out of their garage, they wanted to know about it. I mean, it was a pretty desperate time. We never lacked respirators at Cayuga Medical Center.
I also noticed in Tompkins County there are very few deaths in nursing homes. So you did something right there compared to what other communities.
I think it was the testing and the lockdown, so to speak, of COVID positive areas. Now, we did have outbreaks. Yep. We had fewer of them, so I don't want to say we didn't go through that, but I would say the testing timeliness, the testing positivity, and the success of adhering to the mandate, especially when the incidence went up, was better than other places.
We visited a lot of our relatives through the window. So yes. I remember that. So, the next pandemic, if it does happen, do you feel what do you think you've learned most from this, and could we respond faster? You think?
I think we certainly have lubricated our agility joints. We have practice in thinking out of the box and being bold, and I think that we would understand that earlier mutual commitments to do bold actions that need to happen would be taken because of the positive experience we had. I hasten to say you're always fighting the last war, so the most challenging public challenge is the one we're not expecting. I think if COVID happened again, we'd do very well. I hope that we would do as well with a novel threat that we haven't experienced yet. We've got good people. I think Cayuga Health has good people who are thoughtful, community-focused. The community demands high services and that kind of a response. So I think more of the climate, the expectation, the can-do attitude is our best asset.
Thank you. I just wanted to say how that was a wonderful presentation, very interesting. But in November of 2020, I had a stroke, and the ICU unit at Cayuga Hospital saved my life. So while all of the pandemic was going on, there were other life-threatening things happening. And quite honestly, they took care of me so that I've had no lingering effects. I've had 100% recovery. And so it's I think we have a pretty remarkable hospital and staff, and I'm eternally grateful.
Thank you. We're proud of our stroke program. We're typically lauded by the state inspectors and the national accreditors who come in and talk to us about it, and I'm so delighted to hear consumers of that service. I'm sorry that happened to you, but I'm delighted that the outcome was as positive as it was.
Nurses in the ICU were wonderful.
Super. Hi, Travis.
The numbers are mind-blowing. The cooperation, the collaboration, and the work that was done by you all in the county, it's just amazing. Like Susan, that September, I found myself in the emergency room on a Friday night. Saturday morning, they didn't think I was going to leave. And just to know all this stuff was going on at this hospital with COVID and all these things, and the treatment that I got, the care that I got, the attention that I got was absolutely amazing. And I'm here. And that's because of the work that was done by the folks at CMC. it's a great place. But just to think how this county worked through COVID and all the collaboration and all the work that was done together is just amazing.
Thank you for saying that. Thank you for sharing.
Okay, unfortunately, we should be moving on soon, so I don't know, would you consider coming back to us sometime?
I'd be happy to.
Okay.
And if there's other topics that you'd like, I enjoy the expectation setting. We can respond to the community's needs, I think, iteratively. If you tell us where we can improve, not only where we do well, because we can keep doing that, we're happy to come back on a regular basis. And one last idea, Cayuga Health is committing to really treating the hospital as one component of what it does. That's a big philosophy paradigm change, is our focus on outpatient, substance use disorder, mental health, transportation, and on and on. So I hope that we evolve into a health system that goes upstream of hospitalizations. And if you wish to challenge us and set expectations, I think we work better in that environment where we're running down a goal.
So again, thank you so much for coming in today. Thanks for all the work you did and are doing. And I don't know, maybe you'll come back in 2 or 3 months and do it again?
I would be delighted. Thank you.
Put that in the minutes, please. Thank you. All right.
Thank you very much.
Thanks, everybody.
All right. That was excellent. I just want to remind everyone that, I don't know, I didn't say it today, but at 2 o'clock we have the city coming in to talk about the request for reimbursement for the, did you get your thumb drive back? Okay, thanks. Thumbs. 2 o'clock, the city's coming in, so let's try to get through our resolutions before then, and then we'll see what kind of time we have after the city discussion. We still have goals to do, and we have departmental updates, which I'll just say, you know, there's a chance we're going to run out of time. We do have a lot of stuff going on, so let's see what happens. All right, let's do the resolutions, because we must do the resolutions. So we've got first from Department of Social Services, resolution budget adjustment, enhanced APS grants. We have Kit Kephart here. Hi, Kit.
Hi, how you doing, Dan?
Good, how are you?
Good. So thank you. Yes. So this is, we're excited about this money that is coming to us for the Adult Protective Services Program. This is, I don't know, probably the last of the ARPA funds that we're going to see. But this is money that is coming to us through OCFS, specifically for the Adult Protective Services population. And we've worked with them to develop a plan to pay for rental arrears for this population. This is a population of people that are typically vulnerable adults, people that we oftentimes are representative payees for and provide supportive care. And one of the things that we see periodically, and especially throughout the pandemic, we have run into certain parts of this population that more often than not, before we actually take over the representative payee part of their life, they sometimes are running behind on their rent. And if we are not able to address that and provide a way to pay back their rental arrears, we end up in a situation where people either are homeless or, you know, or we're having to find some other housing supports for them, and we really risk losing landlords that they've been successful at working with but have run behind. So this is a great opportunity for us to really kind of catch people up. It is a time-limited thing. We'll have the first amount of the money that we can spend through September of this year, which is $24,236. And then the rest of the money that adds up to a little over $56,000 that we'll be able to pay rental arrears through the end of September of 2024. So this really gives us a resource to be able to support these folks and make sure that we're keeping them on track to stay in housing, which certainly with a rising homeless population, we want to keep everybody in permanent housing that we can. So that's basically a summary.
Great, thank you. Is there somebody that would move this resolution? Travis moves, Randy seconds. Any discussion? Okay, let's have a vote. All in favor? That is unanimous. Thank you. Okay, and Kit, you have another one, budget adjustment, safe harbor. Is that you?
Actually, I think that's Kate. She'll
Yeah, hello everyone. Yeah, so this is a budget adjustment for Safe Harbor, which funds our commercial sexual exploitation of children work that we do. We got word after the budget process for 23 was completed that we were going to receive $43,350 in the Safe Harbor grant from OCFS. It goes to DSS and then funnels down to us. And so this is just a transaction that allows us to put it in our budget and continue our work around awareness, education, and our outreach campaigns, mostly working with Advocacy Center and doing some good work and continuing to make sure we're reaching out to the rural and homeless youth populations and in rural communities.
Thank you. Can somebody move this one, please? Travis moves. Amanda seconds. Any discussion? All right, all in favor? That is unanimous. Kate, thank you. And while you're here, is there anything you want to tell us? Any quick updates?
Yeah, so just a couple things. Wanted to let you guys know that we are really excited to let you know that in 2023 we are proud to say that we're supporting 2 new youth commissions from our municipal youth service system. We have one in Newfield that is starting. They had their informational session a couple weeks ago and had about 7 individuals that are ready to join that commission and get positive youth development programming started there. And then in the last year, we've also supported, in the last 6 months of 2022, supported the Danby Youth Commission, switching from the Community Council over to a Youth Commission base. And they are also doing really awesome, and we're seeing really great things there for youth development. So we're really excited about that, and I just wanted to share that with you.
Well, thank you.
Yeah.
Hey, Kit, if we could get you back for a moment. Thank you.
I'm back.
Thank you. So normally I wouldn't do this, but we've been hearing some rumors about some issues with the shelter and the possible danger of closing. Is there anything that you can tell us about that? I understand if you can't, and I didn't clue you in ahead of time that we'd be asking you this.
Sure. So I don't anticipate any problems with closing right now. I think that is a rumor. I think that we and our provider, St. John's Community Services, there have been some bumps lately in our delivery of services. Our population of people that need sheltering right now is very high, and we are seeing some leadership change, anticipated leadership change happening at the shelter, but we are working very intensively with St. John's to keep services going. We are working right now to get some congregate sheltering up and running to compensate for some changes in our in some of our other contracted providers that support the shelter in providing sheltering to people. So there's lots of transition happening, but I think we're working very hard to keep things on track and to keep services going. And there's certainly a great need right now. I think statewide, we're seeing shelter need rise, and that's no different here in our community. So, in terms of our service provision, I don't see any interruption of service, even though there have been some bumps. I know I'm being a little bit nebulous here because there's some detail that I don't think is appropriate for this venue, but we are working hard to keep things on track.
Thank you. And how about issues with the hotels, contracting with the hotels to put people up? Is there anything going on there that you either know of and or can tell us about?
Sure. So there's a little bit of change. I'm not going to get into specifics, but it's a little bit of change. We've had a couple of hotels that have raised some concerns that provide us with some backup resources. So not primary resources here, not a ton of people, but we've had some problems. Unfortunately, I think as everybody's aware, we are experiencing a real change since the pandemic with not having very much statewide support around inpatient mental health and substance abuse beds. And so we have a lot of people that are being sheltered right now that have very high needs and that there are not a lot of other resources for. And so as a result, we are seeing, and again, we are not the only county that is seeing this, we are seeing some real challenges when we are sheltering people in various locations. We're seeing some real challenges with some very challenging behaviors, with people getting frustrated with this population. Sometimes they are damaging things. So we are having some difficulty with some providers that are saying, that are kind of pushing back and saying, I don't think we can serve people, or we can't serve as many people. And we are coping with that. We're working very hard right now to get some congregate sheltering up and running, which will mean, some of the sheltering that we haven't been able to do in the recent past because of the pandemic or because of the labor shortage. But looking at getting, in the basement of a church, for example, and having some cots available to shelter people. So we're putting that together and trying to get those alternatives set up so that we have adequate shelter, regardless of any drop off in others being willing to contract and provide that shelter. So.
Okay, well, thank you. Thanks for answering off the cuff like that. And while you're here, is there anything else from your department you want to report?
I just want to let people know that we are seeing the end of the SNAP maximum benefit. So during the pandemic, the supplemental nutrition program provided maximum benefits to many households, not all, but many households. So people saw a much greater than usual SNAP benefit. And unfortunately, that is coming to an end this month. So starting in March, people are going to receive a reduced benefit. It's not reduced from what they would have been eligible pre-pandemic. It's reduced back to those rates. But I think it is going to have a significant impact on some households. And so there is information on the county website under social services about places to contact. If they have questions, they can certainly reach out to us. We will answer all the questions we can and provide them with supports as are possible. But I do think that there are some people that are going to say, hey, even though the state has tried to send out notices and we've tried to inform people, there are some people that are going to say, hey, what's going on? Why did I get this huge reduction? So just to make people aware that they may hear about that in the community. And while some benefits end post-pandemic, we are seeing a return in June to some case processing that we haven't seen for a while in the Medicaid program. I'll probably report this more than once in the next couple of months so that it's out there and people are aware that we'll be doing recertifications again starting in June that haven't happened through the pandemic because that was all on hold, but the state's having us go back there. So, so that's all coming. So I think that's all the update that I have right now.
Thank you. I think we have one question here in Chambers.
I just want to thank you, Kit. Add that the Enfield Food Pantry is feeding up to 600 families now per week, and they are open a couple times per week if people need that, and they have a good volume of good food there, of healthy food actually. But I have a question. I saw some data that the number of homeless people that we're housing last year was around 100, and this year it's about 240. Is that correct?
It is correct. Yes. So first of all, Randy, thank you for the good work that that Newfield is doing, and I know other communities are as well providing really needed food resource for people. So that's great. And we certainly refer to those services when people don't have another alternative. So that's great. Yes, our numbers have jumped dramatically. Yeah. It has been a little dramatic in the last season. And I think again we are very consistent with the rest of the state. We're seeing these numbers rise very quickly. And again, there's kind of a complicated answer that I don't have time to go into right now. But what we're really seeing is the result of a loss of services throughout the pandemic. We're seeing a rise in rental rates, and we're really seeing all these forces come together to really result in people needing sheltering. And it is a heavy weight right at the moment, trying to figure out how we can continue to shelter people. We at Social Services are really shifting, trying to shift as much as we can to a housing first approach. We've always tried to approach it that way, but I think throughout the pandemic, because there were many things closed down and there weren't as many landlords that were working directly with us, we weren't always able to do that to the degree that we have wanted to, but we are putting a concerted effort into trying to get everybody into permanent housing that we can. But it's a struggle, and the numbers of people that are in need of sheltering are very high right now. So it is a concern, and we are working, like I said, very diligently with our contracted provider, St. John's, to pull this together. So.
Thank you.
All right, thank you, Kit.
Thank you.
All right, let's see if we can get through some more resolutions. Office for the Aging, Lisa Monroe.
I'm here.
Hello there.
Okay, hi.
Hi, so let's see. How about somebody moves the first resolution, budget adjustment, County Office for the Aging, Food Net Meals on Wheels, Wellness and Nutrition Grant. Randy moves, Travis seconds. Anything you want to say about this, Lisa?
No, it's strictly a budget adjustment. We got an increase in funding from the state, and it's just passed through right to FoodNet.
Good, thank you. Any discussion then? Okay, let's have a vote. All in favor? That is unanimous. Thank you. Okay, next one up is budget adjustment, Tompkins County Office for the Aging, American Rescue Plan Funding 2023. Somebody want to move that? Amanda moves. Susan seconds. Lisa, anything?
Yeah, this is some more of the ARPA funding that we received directly through the Office for Aging, and we were able to increase hours for our deputy, and we've also passed through funding to Lifelong and FoodNet Meals on Wheels. Lifelong to assist with their tax program. They are the only tax program that, since alternatives closed, that can do free taxes for low-income people over 60 and people under 60 with disabilities. So we are assisting them with that because they have seen an increase in doing taxes for people and calls, definitely. So coordinating that program, and then also to FoodNet for increase in some of their expenses, food expenses and gas expenses.
Thank you. Any questions for Lisa? Lisa, I have one for the part about the increase in the work hours. This is something I always ask whenever I see this coming through in any department, is does the employee want their hours increased?
Yes.
Okay, thank you.
Yes.
All right, then, shall we have a vote? All in favor? That is unanimous. Thank you. Next one up, budget adjustments, Tompkins County Office for the Aging, Generations of Care Respite. Does somebody want to move that one? Randy moves. Susan seconds. Lisa, any introduction for this one? Or?
This is a grant we received. We had a similar grant to this last year called Pause for Parkinson's, but it's a respite grant to provide some respite care to caregivers of any problem. The care receivers could have any issues. It's not just for Parkinson's this time, but we're matching students from Ithaca College to provide their respite services. So it's just accepting and putting the funding in the right budget lines.
Very good. Thank you. Any discussion? All right, let's have a vote. All in favor? Okay, that is unanimous. And then finally, budget adjustment, Tompkins County Office for the Aging, Unmet Needs, Ithaca Neighborhood Housing Services. Somebody want to move that? Travis moves. Susan seconds. Lisa?
So this is some of our unmet needs funding that we do provide to Ithaca Neighborhood Housing Services, but we had additional funding that we decided to give them more this year Historically, the waiting list for these services runs around 45 people or so, and it had increased up to about 78 people, which is the highest I recall seeing it. And we wanted to try to chip away at that waiting list so people could get the services that they needed. And providing this funding allowed INHS to subcontract out to get more workers to do the work. So that's pretty much what that is.
Very good. Thank you. Discussion. Okay, let's have a vote. All in favor? That is unanimous. Very good. Lisa, anything you want to tell us on the way out?
No, I think I don't have anything to report. Okay. Thank you.
Thank you so much. Okay, miraculously, we are at 2 o'clock. How do you like that? So the next item on the agenda is a request from the City of Ithaca for reimbursement for encampment cleanup. Let me just give a little bit of background or a few factoids here. I believe it was last month. The city approached us and said we would like to start cleaning up some of the encampments of cleaning up of trash. And if we do that, can we bring it to the Recycling and Solid Waste Center and you would waive the fees? Well, we're not allowed to waive fees. By county policy, we don't do that. But what we did say was come and talk to us as a committee and we will have this discussion and take more formal action if we're going to do it. So the cleanup happened, I believe, over 3 days maybe. And in the end, 47 tons of waste were brought to the Solid Waste Center. The charge for that is $4,553, which the city paid or will be paying, and they're asking us to reimburse them. So that's the background. We have a number of people here from the City of Ithaca. I don't know which of you would like to take the lead and say hi and start talking with us.
Hi, my name is Lisa Nicholas. I'm the Director of Planning and Development for the City of Ithaca. I know that we're waiting to be joined by Deb Mullenhoff and Mike Thorne, the Superintendent of Public Works, who would be able to give you some information about the trash that was removed from the site. And we can be happy to answer your questions about this request and what our plans are for addressing the issue of unsanctioned encampments.
Thank you, Lisa. Would it be helpful to you if we waited a few minutes for your colleagues to join?
I think it might be helpful because I think hearing from Mike Thorne would be very helpful about the process of the cleanup. Would that be possible?
Yes, it will be. Thank you. So
thank you so much.
Well, you're welcome. We'll start on some other business, and then somebody will clue me in when your colleagues arrive, and then we'll switch back over as quickly as we can. Is there anybody from our departments that would like to take this time to report to the committee? Lisa, I see you. Hello.
Hi, Dan. I just wanted to give a brief update from County Administration.
Oh, yeah, we did skip that item. Yeah, please go ahead.
Sure. Just to update the committee about the progress on the implementation of the security measures at the Human Services Building, something that we've been working on for several months now. The county admin department has been working closely with the departments in the Human Services Building, as well as facilities and our new employee health and safety coordinator. And it continues to be a work in progress. The screening device was delivered, and we've encountered some complications with its installation and the configuration in the lobby of the Human Services Building. So we've been working together with all of the parties and the facilities department and the company for configurations that may be able to work in that space. So I just wanted to update the committee that we are working diligently on it every week and trying different different ways to make it work in the lobby without additional expense or configuration or major changes to the building. We may ultimately need to reconsider the device itself. So I'd be happy to field any questions on that. My only other update was and I'd mentioned at the legislature meeting last night, the closing date on the applications for homeless services coordinator is February 27th, and we will be interviewing candidates shortly thereafter.
Well, thank you. Any questions or comments for Lisa? All right, Lisa, thank you.
Thanks.
All right, we are now back to our regularly scheduled program. Deb Mollenhoff, Mike Thorne, welcome. We gave a brief introduction about what happened and when and how much money and tonnage was involved, and it's back to you now, whatever you'd like to tell us and say to us.
Hi, thank you. Thanks for having us. I think we're just sort of here if you had any additional questions, and I know Mike is here. He is much more versed in the actual cleanup and what was happening. So I think you had sent a couple of questions in. The first one was just kind of a review of what we have already cleaned up, and I think that maybe would be helpful for you to hear that from Mike. And then between myself and Nels and Lisa, we can kind of give you a snapshot of where we're headed for the future. Does that make sense?
Yes, that sounds good. Thank you.
Great. So Mike, I'll let you just give an overview of what DPW has done already in terms of cleanup.
Sure. So a few weeks ago, we cleaned up that, I guess for lack of a better word, the peninsula there by Burnley Street Bridge. It's an area that's, bounded by a couple of creeks and drainage ditches, and it was very difficult to get to. It had been growing for a while, and I believe last fall it caught fire. And so the person who was living there had moved out, but there was quite a pile of junk and garbage still left over. A lot of that garbage was needles and propane tanks and things like that. And so our DPW crews went out there to clean it up. And I believe we worked with Leo at the solid waste facility just to make sure that we were delivering the waste and separating the waste as much as possible. So we had a couple of loads of scrap metal, most of those coming from shopping carts, but there was other miscellaneous scrap metal in there. I believe they separated the propane tanks and things like that and left a separate pile, and also went through with a bucket and a handheld picker to pick out as many needles as they could find. And so I believe there was a large bucket of needles as well. From that cleanup operation, I think there was about 12 truckloads total. But I don't know. I don't have any tickets from the solid waste facility or the tonnage or anything like that, but I understand the average load was about 5 tons. They ranged from 3 to 9 tons. But I think 5 tons is probably a good average amount for a truckload of garbage. They also went out to Cherry Street because Cherry Street was a little bit easier to clean up, and they did quite a bit of cleanup out there. I think they might have picked up about 3 or 4 truckloads. Again, I'm not sure what the total amount. Barb, I don't know if you know.
It's 47 tons was the total.
37 tons?
47.
Typically, a truckload is 3.5 tons of waste, depending on what's in it.
Okay. And it was 37 tons, you say?
47.
47 tons, okay. All right. So one of the questions that came up was, how much more stuff is out there? And, we can kind of give it our best guess just based on, what we saw at Cherry Street. I think the next largest debris pile is behind Lowe's, and that's there's been an encampment back there. It's currently abandoned. There's been a number of fires. That's difficult for us to get to, but we think that we're probably looking at 20 to 25 loads just behind Lowe's. And again, right now we have no plans for cleaning that up until we have a better picture for, how we're going to move forward with things. Again, mostly because it's difficult to access that area. And then the third large area is there at Southwest Park. And again, just our estimates, we're thinking probably 50 to 75 loads if we were to clean up all of Southwest Park. And that's spread out all throughout the area back there.
Okay, thank you very much for that info. I do want to get back to this question of how much more and what the plans are going forward, but I do want to, there's a couple of parts to this. I want to go back one step about the money part. So our cost, and Barb, jump in when you're ready, our cost, what we charge people is approximately $1,000 a ton. It's a little under that.
No, it's $100 a ton.
$100. I did that to you twice, didn't I?
It's okay. I was waiting for it.
I don't know why I got stuck on that. Okay, a little under 100, which is why the 47 tons comes to 4,553. But I just wanted to make clear, because I wasn't completely sure myself, and I talked to Barb, and I got some of my facts straight. So it doesn't cost us nothing to receive this material. We have to bring it to a landfill. And so, and again, Barb, jump in when you're ready. I asked for the figures of how much it actually costs us in dollars. And it cost us $66.80 per ton to truck that stuff away and get it accepted at the landfill. That's going to increase by 7% on March 1st.
January 1st it increased.
Oh.
At the beginning of the year.
Oh, so that is the current rate?
Correct.
I'm sorry. Thank you.
I apologize for misunderstanding there.
No, it's no problems. And that what that doesn't take into account is our fixed costs, right? Staff time and capital debt service, all that kind of stuff. Yep. How did I do, Barb?
You did perfect. Let's keep going.
Let's keep going. So I just wanted to make clear that if we do agree to reimburse the city for this money, it's real money. It's not just like saying, oh, we had a conference room, normally we charge for it, today we're not. It's not like that. It's actual money that will be flowing out. Okay, so back to going forward. So Mike, you said that right now there's no plans to do it on the parcel behind Lowe's, that it's difficult to get to. It sounded like you said a big part of the reason you don't know about going forward is it's just the logistics of getting in there. Was that kind of accurate?
Yeah, I think I would personally like to see a plan for it not being sort of settled again, mostly because it is so difficult to get to. Of course, we don't want the settlements in some of the places where it's created nuisance conditions, and certainly at the end of Cherry Street, we fielded a lot of complaints. There by Brinley Street, we fielded a large number of complaints. Behind Lowe's, I haven't heard any from Lowe's, but it's pretty messy and filthy back there, but haven't heard too many complaints. With Southwest site, again, it's kind of out of sight, out of mind, but there is a lot of garbage back there.
Okay, thanks. So you've brought in both relevant questions, although there may be others, there probably are, which is, how much more and how do we stop it from just getting trashed again? So is there anyone else from the city that would like to address either or both of those questions?
Sure. I'm gonna give you an overview, and then my colleagues are here, and I see also George McGonigal is here as well, who is on our working group. So I think we are pretty close to having a policy written that will be ready, I think, to convene a whole bunch of stakeholders and essentially say, here's where the city has landed, and we're going to be looking to these stakeholders for some feedback on that, right? So we're kind of doing two things simultaneously. We're trying to incentivize the Southwest area with some limited amenities as a place where we would call it, let's say, sanctioned encampments. And then we are looking at, we've been looking at a number of different models for how this works in other communities. And some of them are defining what they're calling emphasis areas or critical areas. And those would be areas in which are known to be problems or are known to be locations where people tend to camp, that we want to de-incentivize camping in these particular locations. So I think your point is well taken, that we can't just perpetually continue to be, having camping, having people move, cleaning up, having camping, having people move, cleaning up. That's not really what we're looking at doing. So the policy will be around a collaboration of people where we're looking at a voluntary relocation to this more sanctioned area in the Southwest. And in the Southwest, we would put like very basic amenities, porta potties, showers, a construction trailer, or maybe there can be the storage of things like paper towels and bottled water and whatnot. And the city is moving in the direction of just managing that as a facility or a site, not managing the people that would be using that site, but kind of managing that as a facility. We would consider this a pilot program. We would consider this a phase 1. We would consider it a learning opportunity to try this strategy while a parallel process is moving along with, again, many other community partners to look at what are we doing to offer housing, more permanent housing solutions, supportive housing. As all of those projects move forward, these kind of parallel paths ultimately will hopefully converge in getting more of the people that might be in one living situation into housing. Kind of where we are at now. The working group is reviewing the latest draft of the policy tomorrow. And I will invite Nell or Lisa or George to supplement anything that I just mentioned.
Yeah, this is Nels Bone. I just want to emphasize that the working group has discussed, strategies to clean up sites and keep them clean. But we don't suggest going about cleaning up every site until we have established that kind of a framework and have a strategy for that. So as Mike mentioned, I don't think there's any immediate plans to do a citywide cleanup of those sites until we have really developed some strategies to prevent those sites from being repopulated with the materials and trash. So it's important to think that this is a phased program, and we're trying to establish what the city can accomplish in phase 1. Again, kind of the focus on Southwest and trying to disincentivize camping in some areas that have been problematical in the past, but not trying to do it, not trying to do a broad brush, comprehensive city approach, and trying to learn from the lessons of an incremental approach. There would not be a total ban on camping throughout the city. It would be an incentive-based system trying to voluntarily direct people to areas where there are support services. That's the thinking of the draft policy that still needs a lot of review.
Okay, I'm going to open it up to the committee now. Are there any thoughts, questions, comments? Travis?
I'm okay with covering the cost of the first cleanup, as long as, we do have a plan in place to keep it from becoming occupied again. Huh? Oh, I thought I wasn't talking into the
Sorry.
mic. The other sites, that's a different conversation. I think that's a separate conversation. We've had one cleanup already. That's done. So I would support that. I wouldn't necessarily make a decision today until we have more information on the other sites.
Amanda.
Thanks. I'm thinking similarly. I think, although I guess I would propose that we reimburse for half of it because it will take our staff time and our real money. So I would propose half. And I think offering or helping out in this way right now would not mean that we would absolutely help out if there's a future similar situation. It would have to, I think, again, we would have to see what was happening and what the plan was going forward. So that would be my proposal, would be half.
Randy, George, I see your hand up. I'll get to you soon, okay?
First of all, I'm glad the city is taking this on and appreciate the DPW folks for doing that job. It must have been a tough job to clean that up. I support reimbursing them the full amount for this first series of truckloads. And I agree with everybody else. We have to wait and see on the other areas. I really hope the city moves forward and does clean up more areas. We just heard from our social services director that the number of people that we're putting up right now is 240 people compared to 100 last year. So it's a fast-growing number that's happening all over the state for numerous reasons. And we need to have places where we can provide services to people. So I hope that the city moves forward fairly quickly. So thank you.
George. You're muted, Mr. McGonigal.
Ms. Beckstrom wants to go, so she can go.
No, I'm more than happy to wait. Thank you.
Well, thanks, Dan. I'm just going to speak for myself. So if I insult anybody, it's not the city's fault, it's my fault. I've been involved in this homelessness issue for over a year now on a close-in basis. And I come to the county board meetings every month. And every month, somebody on the county board, county legislature, excuse me, asks me about when are we going to clean up the jungle? And when are we going to clean up the jungle? And I met with Dan a few weeks ago, and we had a really good conversation about this. And he suggested to me that although the legislature really didn't want to do it, that one option they have was to actually fine the city if we don't clean things up. And I think we've expressed over and over again that cleaning up the jungle is a huge job and that we will need help financially to accomplish it. Our DPW spent a tremendous number of hours cleaning up what we've cleaned up so far. That's real money also. Equipment involved, it's a dangerous job, and we've got a good start on it. I appreciate the fact that most of you seem willing to pay the entire less than $5,000. I think that's totally reasonable, and I hope that we can continue this partnership as we gradually clean up other parts of the jungle. One thing that we should keep in mind is that this sanctioned encampment that we're proposing in the Southwest Park, in theory at least, is going to make it easier for the county to provide services for homeless people, because there'll be more in this one particular area, and it will be much more accessible. So the county may save money, actually, in that regard. So I guess I really want us to establish a partnership to deal with this problem. And fighting over $2,500 is really, really discouraging. I'll just leave it at that.
Well, George, I don't really hear anybody fighting over $2,500. There's a few people that said we should pay the first round and come up with a plan moving forward. That's kind of what I heard from a few people. So that's not a bad thing.
I'm sorry, I heard one person say that you would pay half of this tipping fee.
Amanda and then Barb.
Yeah, I'm not sure that's fighting, George. That I think that we can fight about it if you want, but that's my perspective. I think that, as you yourself said, as apparently Dan said to you, the county could fine you, the health department could fine the not you, the city, and that, because the city might get fined, doesn't entitle you to money from the county. I think that this is a negotiation, and I'm not into fighting over $2,500, although I've done it over other things. I can think of a few. And I'm certainly not going to, die on the hill, as Deborah likes to say, over it. But as much as it's a partnership, it's also city property. And yeah, I'll leave it there.
I just need to mention Travis had asked to be excused at 2:30, and he had another thing to take care of. Barb, did you have your hand up? I wasn't sure.
I did have my hand up. Thank you. I'm doing a lot of thinking. This is my last month, a little bit over a month before I retire. And I have a very different perspective than I did when I first came in 37 years ago. And the one thing I just wanted to make mention, mostly for the county, is that the process that was spelled out in the resolution and procedures for waivers is that there would be a proposal received, or a request, and then the county would then move it to a committee, which would be this one, and to the legislature with a resolution. So that should be honored. The other thing to think about is that this is work both by the city, but also the city as a hauler. And just to put it out there, because I'm not a policy maker and I can't, that's not my role, but that, as a hauler of trash, we don't have waivers for that sort of thing, but I understand that you look at it totally different. And the reason that Dan brought up, well, Dan did bring up that the cost to us was $66.80, which, it has to somehow be paid. And I don't know. So just say it's 70 out of the total of 100. Maybe that cost could be taken one way and the remaining, my staff costs and the capital costs, could be taken another. But most importantly, as we look forward, I know that Liz is on this as well, and she's with the health department. And we go way back in terms of our backgrounds, but just suffice to say for the future, I would suggest that when you develop your plan, you take into account environmental, safety, and health considerations, because some of the concerns that I've had, knowing exactly what was brought when it was delivered, is there needs to be some soil testing to make sure that we're not in a position here where we can take contaminated soil and there's liquids we can't take. And obviously there are protocols for needles that are governed both by the New York State DEC and the Health Department. And there are, you don't have to spend much money, but there are consultants, and we work with one, and there are others that would do a fine job in giving you limited recommendations to make sure that it doesn't turn into an unfortunate set of circumstance that violates DEC and Health Department laws. That's it. That's all I wanted to say.
Thank you. Randy.
Yeah, thanks, Barb. I agree. I think public health is extremely important. And all city residents are also county residents. And we need to work with the city any way we can to clean this place up. I think it is a major hazard, and it affects a lot of people that live in the county as well as the city. And I'm for paying or reimbursing the city for all the cleanup they do. So I hope you move forward.
Okay, I have one more question. I just so that it's stated clearly. The area that you, Mike, you called the peninsula, in other words, the area that was done first, I think. So I heard the rest of it, that there's plans in the works to incentivize having people move towards other areas with some infrastructure in place. But what happened? Spring almost arrived last week. It's coming next month. I mean, people are going to be moving back into these areas soon. What happens as people start moving back into that area that was just cleaned, the peninsula area?
Yeah, that's the big question. Law enforcement could certainly be involved in one way or another, but I think that probably the better approach is to get the group of social workers and volunteers to help people move as soon as the first tent goes up in a place that we don't want it to go up. So if on April 1st or April 2nd, the tent pops up again on the peninsula, that's the big question. Who tells that person to move? I would suggest that, well, I don't know what I suggest because I'm not sure how the county is set up in this respect, but we could certainly use help from whatever agency deals with the homeless encampments. I know that the city doesn't really have that department or skill set, and any help we could get from the county would certainly be appreciated to say, hey, don't camp in these areas where it's created large nuisances, but camp in this other place where, at least you might have a shower and regular trash collection and things like that. So, I mean, it's a great question, though. I'm not sure what the right answer is on that.
Anybody else?
I'll just add some additional information if
Please.
I can. When I said we were looking at de-incentivizing as well, there were several of us that just did sort of a drive-through, walk-through of some of these areas, and there are some additional, I would say, passive things that we could do that would make these areas less attractive for camping. So like the one area we talked about, could that actually become a pathway where some trees are removed and some like meadow grass is planted that is mowed all the time, and could the pathway have lights on it? So that these are all things that would make that less attractive for someone who might want tree cover or more darkness to camp on. So that's going to be part of the strategy that this working group, I would say, tightens up as we put the final touches on this policy together. Like I said, we're meeting tomorrow, and then very soon after we'll be convening a group of stakeholders to sort of walk people through the choices that we made in the policy, and certainly members of the county will be included in that discussion and conversation. So any suggestions that you would have can be fed into this working group that's, again, tightening up this policy.
And just to add some clarity to the peninsula site, that area is currently unvegetated and is in need of some stabilization and vegetation. So there may be one strategy we're exploring is to create that as a revegetation area until we can stabilize the vegetation and provide some sort of fencing around that particular hard to get to, well, one way in and out kind of peninsula location. So typically fences are not going to be very effective at controlling where people camp, but in this one case, it may work to reestablish vegetation on that peninsula.
I mean, that's something that would need to happen in like May. Is the city actually maybe going to do this?
We are very aware that the April 1st is sort of the code blue deadline, so that is kind of a target date for us to at least start to put some of these mitigating factors into place. So we're working with that date in mind, knowing that that is a sort of a stop date or a target date for us to want to at least have some of these pieces in place before, again, we just sort of get back into that cycle of people camping where we don't want them to. So we're furiously doing everything we can in order to meet that deadline to at least have a plan and some easy, quick strategies that we can implement very quickly as we put the rest of the pilot program together.
Amanda.
Yeah, I don't know if this maybe is for Barb or county administration. I don't know if they're still here. But so if we agree to reimburse this, where does the money come from? Is it just Barb, your department, just how do we do that?
No, I mean, we're losing money right now, not getting more from recycling revenues. We can't do that, but what Lisa had said is it would come out of the county fund.
Okay, just like.
Yeah, because basically paying for the hauling of material to our facility, and that wouldn't be in our area. When the Red Cross years ago asked for emergency help due to flooding, that was also a county fund reimbursement.
Yeah, thanks.
Okay, would anybody on the committee like to move a resolution to reimburse the city of Ithaca $4,553 for expenses incurred in the cleanup of the encampments, and that money's to be taken from contingency? Travis is moving that. Randy is seconding it. I know it's not great to do resolutions on the fly, and I apologize. Lisa or anybody else, is there any wording that you feel like we need to make sure we insert into this resolution if we're about to vote? Oh.
Hi, sorry, this is Bridget. No,
Hi, Bridget.
I don't think so.
Okay. Anybody? Amanda?
Yeah, so two questions. One is, if we vote on this, does the full legislature have to vote on this? Or is it because it's small enough amount?
Yes, correct. It would be the full legislature as well.
Okay, so it would go ahead. My second question is to committee members, is anyone else have an appetite of what I propose to do half? No? Okay, then I won't make an amendment.
Spirit of not fighting. Okay, so we do have a resolution. You have the wording more or less? More or less, okay. I just want to make sure, because again, we're doing this on the fly. Is there anybody anywhere on the screens or elsewhere that is thinking, uh-oh, there's something you left out of that? Mike.
Yeah, if we are able to put some minimal amenities out there at Southwest Site and start to direct people out to Southwest Site, we'll need to do quite a bit of cleanup out there because it's like uninhabitable right now. And so if we're all on board with that idea, we're going to have more truckloads coming soon. And so I don't know if the resolution might want to cover that or if that's just covered at a later date.
My personal feeling is that's a later date, but I see Barb's hand up.
Yeah, again, Mike, you know, I have a lot of respect for you. We've worked together over the years, but I saw some things that weren't good in terms of what came in here. And I don't want to violate the permit for our transfers, for our recycling center at all. And I don't want to go backwards. But what I do think you need to do is make sure that what's delivered to our facility is acceptable. What I'll do is I'll send you, if I mean, your assistant might have it already, but I'll make sure we get you the permit and the requirements for what we can accept and what we can't accept. The needles I did look into, and it's considered by the DEC to be a home, not a business. But again, we have to prevent as many as possible from going in. I'm more concerned about the soil and what's being brought in and making sure when you test, and the tests are cheap and you can do that with a local company, that material is acceptable for bringing to our transfer station. I also think, you know, there's a lot of, you know, we can't accept certain things. So I'll send you that permit application. I'll send you the rules of our facility that are in our local law to make sure that you cover the bases on that.
Can I just ask a question? If, you know, to get to that level of detail on waste disposal, and I totally understand where you're coming from, Barb, but that's going to take a lot of additional costs for the city. A lot of
No, it won't, Mike. No, it won't. Not at all. I can talk to you about that, but it will not take a lot of cost.
Okay. My question was going to be, is there an alternative to just simply dispose of it as hazardous waste? And
yes.
I'm sure that would be quite a bit more expensive.
Okay.
No.
I'm going to let the two of you talk offline about that. So it sounds like there are some plans in progress for more to come, and we definitely will want to know those, you know, as much detail in advance as you can on that. Deb.
Yeah, I was just going to say that part of the sort of policy and the convening of stakeholders, we also are probably going to be putting a budget together with sort of what will it look like for the city to, what are the amenities, what are needed. And so I assume that what Mike was talking about in terms of getting that area ready to be sanctioned, we're going to need to outline a budget. So we'll be able to provide additional details with like whatever it looks like moving forward. So we are extremely grateful and appreciative for the support for this, what we're kind of considering the emergency cleanup phase. And then we're going to need to work together, you know, as kind of partners in order to figure out what pieces we all have to put together in order to move to this, you know, sort of more semi-permanent pilot program. So we appreciate your support and your collaboration, and thanks for considering our funding request.
Thank you. Okay, so we do have a resolution on the floor. Last call for discussion. Okay, let's have a vote. All in favor? That is unanimous. Very good. Thank you. Okay. I want to thank everyone from the city. I know that this is a difficult, obviously a really difficult issue, difficult conversation. We took a little baby step today, and we'll see how we can go forward. Good?
Thank you very much. Thank you.
Thank you very much.
Thank you. Okay, we are back to our agenda, and there's a couple of things we haven't done. So first of all, let's do the things we have to do. Advisory board appointments. We have appointments to the Community Mental Health Services Board, Mental Health Subcommittee, Tracy Decker. To Community Mental Health Services Board, Substance Abuse Subcommittee, Ronald Schoeneman. And to the Youth Services Board, Marley Thompson. Somebody move that, please. Randy moves, Amanda seconds. Any discussion? Okay, let's have a vote. All in favor? That is unanimous. Very good. Thank you. Let's do the minutes before we forget that. We have the minutes of December 19th. Will somebody move that? Travis moves. Randy seconds. Any discussions on the minutes? Okay, let's have a vote. All in favor? Yep, very good. It's unanimous. Thank you, everybody. Okay, those were the must-dos, I believe, right? We covered all the must-dos. Okay. What we still haven't done are the department goals, committee goals, some department updates. So we only have 15 more minutes scheduled. It's going to be tough to get all that in. Committee, what would you like to concentrate on? Dr. Clark is still here. Sure thing. Let's have committee updates. J.R. Claiborne, Veteran Services, you got anything for us?
All right, good afternoon, everyone. Just a few things. Let you know that still out here representing. I was able to attend the Cornell Student Veterans Resources Fair last month. Also, I did a co-presentation with the Department of Labor representative to the Tompkins County SHRM chapter. And of course, my Warrior Writers, we just had a great meeting last night. And I've had the honor, I guess it came across as an honor to me when I got the invitation by the New York State Division of Veteran Services to be one of the speakers at an event happening next week in Kirkwood. So we're just basically talking about services provided by veteran service agencies.
Thank you, JR. Any questions or comments for JR? Randy.
Yeah, JR, I'd like to set up a time to come meet with you and to learn a little more about what you do, and I'll invite some more legislators who may be interested. So I'll touch base with you on that. So.
Thank you. I look forward to that. Appreciate it, Randy.
Okay, we have more departments here. We have whole health here. Frank Krupa, do you have any updates for us?
I am here. I don't have any updates for you today, Dan.
Okay, thank you. I'm just learning to just say whole health, not Department of Whole Health. So I'm getting, that was my first live attempt. Ken Clark, Human Services, Human Rights Department.
Good afternoon. Just a couple of updates. Wanted to invite you and others in the meeting to attend our program next week on the 28th, Black History Month program, which will be focused on the impact of Dr. James Turner and his impact on Cornell and in the city of Ithaca. Dr. Turner was the founder of the Africana Studies and Research Center at Cornell and very much involved in this community for over 5 decades, including serving as chair of the Human Rights Commission in the 1980s. So that we will be having a panel discussion with some of his former students and colleagues on next Tuesday, the 28th at 5 p.m. That'll be a Zoom event. Our office is working with the State Division of Human Rights on a couple of initiatives which have been coming at the division's invitation. One, which will be an in-person fair housing presentation in May, and also working with the Senior Director of Hate and Bias Prevention to look at ways in which to do programming in our local community around these issues. They were impressed with the programming that we've done and as a result wanted to collaborate with us toward that end. I had more, but for the sake of time, I'll forego those other updates I would give at this point.
Thank you. And while you're speaking, Rob put up on the screen that the event you just described will be streamed live on YouTube.
Yes, on YouTube. Yes, that's right. Thank you.
Very good. Any questions or comments for Ken? Okay, thank you. And then we also have John Mazzello from the Human Services Coalition. John, do you have anything for us? Caught you off guard, right?
You're on mute, brother.
Hi, I'm sorry about that. I was on mute. Sitting in for Cindy, who's on vacation, but no report today. Thank you.
Hey, John, I just wanted to let you know that I'm the new county representative to the Human Services Coalition Board, so I don't think I've told anybody.
Great to know.
I'm telling you.
Well, we're having a board meeting on Friday, so I'll get the information to you right away.
Okay, thank you. Appreciate it.
Okay, thanks.
Okay, I think I covered all the departments. Is there anybody else out there? Okay. So in our agenda packet and earlier, I think in an email, we got the list of departmental goals. So I do not want to go through them all. I hope you all had a chance to look them over. So what I'm suggesting is either, Bridget, if you have anything that you wanted to highlight for us, or if any of us have questions or comments, we can discuss it in that way.
Yeah, I don't have anything specific to highlight, although department heads are here to answer any questions that you may have.
Well, I read through them and just, there's just so much. It's just such a great reminder of all the multiple things we do, and that's just some of it, right? Not everything's even expressed in there. I certainly had nothing came up for me at all reading it except, great, thank you for doing this stuff. Any other committee members have questions or comments? Okay. Then let us do the same process with the draft committee goals that I sent out, and that's also in the packet. I had sent them out and asked if anybody had any particular comments one way or the other. I didn't hear much back except sounds good, and I don't remember getting any suggestions for changes, but here we are live. So committee, is there anything you'd like to say about these goals?
They look great.
Okay.
I would say, and I know that this is discussed by a couple of the departments, and what I'm learning being on the legislature is that there are so many things that we're doing and doing well. But I think there's a connection issue in because there's so much information. And I know, I forgot who talked about it in one of these, I forgot which one it was. And maybe it was Office for the Aging, because you look at all the stuff that they do, I mean, it's a long list. I mean, there's got to be 30, 40 different things that they're doing. So I think a way of how we can filter that to people without burying them with all the information. So I don't know how that works. Dominic and I talked about a little bit is how do you provide, how does the information get to people that can use it, that aren't overwhelmed with it? And when you go to the website, it's just so much information. I get overwhelmed from it. So I don't know how where that fits in the conversation, but I think there's a way for, whether it's through, well, I won't say AI, but because that's a mess. But there's got to be a way for the county to think about how to almost through a profile related system. Like most software is profile related. Amazon, it's all profiles, so they know who you are, what you do, what you want, what you spend your money on, all those kinds of things. And there's got to be some way for us to make it easier for people to consume. So I don't know how that fits in here, but I'll be talking about that as we go through this stuff. That's why I'm actually visiting all these departments, because I'm trying to learn all this stuff. And every time I go, wow, wow, wow. I mean, and if I'm trying to learn this stuff, that means 98% of the people have no idea. When happened in one of the youth service meetings was the Open Doors program for youth. I had no idea what that was. I think it's a great program, and they've had struggles because of people leaving and whatnot. But I think that's such an opportunity for getting more people in that program. And maybe we should be paying people to do that, as opposed to just asking people to do it for free. And maybe you get more people to enroll for youth to have a place to go temporarily. So that's just my thoughts.
Thank you. So I think what the issue you're bringing up is how to get more of the information that we provide, more of the services we provide, into the hands and minds of the public. Is that kind of it?
Yes.
Is that it? Go ahead, Amanda.
Do you want to join the Public Information Advisory Board? Because that's all we ever talk about.
I didn't even know it existed, so yes. Yeah, really, I didn't.
Yeah, it's a small advisory board that really works with Dominic, and I'm the liaison to it, but there's several, other communications and newspaper folks and journalists from the community who volunteer, and we meet, and Dominic kind of tells us what he's been working on, and we've had some good discussions lately, but that's a big thing is, we don't have great local media, and Dominic's only one person trying to get out information for all these departments, and it's a huge challenge. And
it's improved greatly.
It's improved greatly, and he's got all kinds of interesting things that he's doing. But yeah, he can only do so much and work with each department. So I think it's an ongoing conversation about how to do that and do it well. Yeah.
Susan.
Yes, I want to speak to that because, it's something that, with social media and lack of a lot of local media outlets, how we get information out is very fractured. And I saw this consistently when I worked at the library because we had so many programs, so many terrific programs, so many incredible partnerships. And I'm also thinking about GIAC. GIAC has the same thing as incredible programs. So how you get that information out is a real challenge. So I often wondered if certain organizations if there could be some other kind of public information group. I don't know what that is, but maybe to work with this group for the organizations that have a lot of programs to work with the group to get information out, and because there's a lack of outlets for that.
Yeah, definitely.
I think there's a ton of outlets. The problem is there's so many of them, and how do you connect with the variety of outlets for who you're trying to target information to? Folks may say, people who work in mental health, people who utilize mental health services, but there really isn't a lot of mental health services in the county. And you go to a meeting with all the mental health services, you're like, wow, there's so many different mental health services. People don't know about them. People don't know how to access them. And when you're in crisis or when you're in need, like you're not thinking, okay, who has a TikTok, who has an Instagram, who has a Snapchat? Right. And when you're talking about young people, right? Yesterday, Instagram was the thing. No, they don't use Instagram no more. It's TikTok and Snapchat. And then how do you connect to all of those folks? Because you got to send these friend requests, right? Otherwise, they're not getting any information. So I think the task that Dominic has and in this group is overwhelming, because how people get information or how you connect to people to give them that information, there's so many platforms. And what works for a 51-year-old versus an 8-year-old, a 15, 16-year-old is so different. So it's a huge challenge. Bringing up GIAC, you use the standard. It's Facebook, it's the mailing list, the email list. People don't check emails anymore. Everybody's moving to SMS. And so now you got to text message everybody, right? So everything is constantly changing. I don't wish to be in Dominic's shoes at anytime soon, because it's a huge challenge.
Yeah, I know we're running out of time, but this is good, and we do talk about this almost every month at PIAB, and there has been conversation about, well, maybe Dominic needs another person in the communications department to focus on outreach, to focus on social media, to really start doing some of these bigger things that we could be doing. But on a different topic, just related to the goals, when I think about HHS committee, I feel like there's not really a lot that we do. I think our departments do all the work, and we're really here to help them and support them. And, if there's things that come up that we need to support quickly, or, that nobody was expecting, I think that's kind of what we're here for. So that would be my addition to the goal conversation, is in a supportive way.
Would you like to actually add that as a goal? And if so, can you give me some phrasing?
No.
I mean, I think what I heard you say is this is what we do, and I agree.
Yeah.
I don't mind if we want to write it down as what we do.
Well, okay, I guess it would just be, facilitating a place where we can have conversations with our staff and department heads, but also just functioning in a supportive role as policymakers, not micromanagers, but people who are supporting them in the actual work that they're doing. So that was not short.
Let me ask you a question. How about saying support the county departments in their goals?
Yeah.
And achieving their goals. Is that get pretty close to what you were doing?
Yes.
How do we feel about that?
I think that's fine. I definitely agree with Amanda 100%, but I would say that, part of our job is to challenge the departments on issues that we hear about from our constituents, and not challenge in a way that's, why aren't you doing this, why aren't you doing that, but say, here is an issue we're hearing a lot of people talk about. How can we help with that? How can we help take away that burden? Yeah. Definitely not the other way around, like chastising. And so, but that's great.
Okay, thank you. Randy, I wanted to go back to yours. Do you want to try to add this as an HHS goal? Do you want to try to add it as like a bigger level of the whole legislature, all the stuff we do?
I would like to add as, well, I'll write something up.
For HHS?
Yep.
Okay.
Yeah, let's narrow it here and see what, see what happens.
Very good. So it'll be some version of get the information out farther and wider, some version of that.
Yeah, I'll do a little paragraph and draft it up.
Send it around. All right, we are at 3:02. Is there anything we didn't get to? We didn't get to committee member liaison assignment reports. Is there anything anybody wants to say? Okay, any last business before this committee? Going once, going twice. We're adjourned. Thank you, everybody. Was that a? Oh, yeah, okay. Committee chairs have the